Hello, my name is Scott Wilson. I'm an orthopedic cancer surgeon who works here at the Atrium Wake Forest Baptist Comprehensive Cancer Center here in Winston-Salem. I would like to share a dream I have with you of creating a retreat facility that will promote and extend the cancer care services we offer with overnight and weekend programming. It will host our cancer patients, their families, and their caregivers, and it will be located in a beautiful secluded forest just 30 minutes away from us. Let me explain why I wish to do this. The primary experience patients have upon entering the cancer center is weighted heavily on diagnosis, treatment modalities, and post-treatment surveillance. Despite the excellent care that we provide our patients, I still see some patients really struggle with their disease. For many of our patients, just the size of our facility is intimidating. The process of finding parking, checking through security, and then figuring out where to go to see a doctor or to be with a loved one can be a source of real anxiety. Often patients are extremely anxious and frightened about their diagnosis and their prognosis. Multimodality therapy, including surgery, chemotherapy, and radiation therapy, can be very difficult to understand and coordinate. They seem lost in the complexity of the medical system and truly challenged in their ability to navigate a path to emotional health and mental well-being in the midst of their crisis. As much as I would like to help my patients with their emotional and psychological needs, I often find myself too busy doing surgery. I am charged with orchestrating a team of professionals to do operations on patients that are sometimes lengthy and demanding. Or in front of a computer, managing patients' medical records and performing administrative responsibilities. I communicate often with my colleagues to coordinate patient care. One thing is for sure, that for every patient encounter, there's a lot to talk about. After introductions, I ask the patient about the history of their problem. I review the clinical information we have received from the referring physician's preliminary workup. This may include laboratory, radiology, and pathology reports. I take the time to review all pertinent radiology findings with the patient so they can have a visual impression of their tumor, its size, composition, and location within their body. This description includes the proximity of blood vessels, nerves, and bones that are pertinent to surgical planning. I explain the pathological significance of any biopsies that they have had. If they need a biopsy, we can sometimes perform a fine needle aspiration or percutaneous core biopsy in the office. I review specific surgical procedures that are best used to remove their cancers. We discuss the benefits and the risks of surgery and then schedule their operations. Often, we also discuss how surgery is integrated with chemotherapy and radiation therapy to provide an optimal treatment program. Postoperatively, we review the results of surgery and the recovery. In subsequent visits, we examine physical findings and surveillance x-rays and lab results to ensure there's no local recurrence of their disease. Yet, because there's so much that has to happen in the course of a clinic visit, I find there is little time in order to ask the patients how they are doing with their disease and whether or not they're using our cancer care services. These services include integrative and palliative health care programs and psychological and pastoral counseling. They are designed to address the emotional, psychological, and spiritual needs of our patients. The integrative oncology services that we offer include deep relaxation and mindfulness training, oncology massage therapy, yoga, tai chi, acupuncture, spiritual care, healing touch, and therapeutic art, music, and writing programs. Other support programs include palliative medicine, cancer rehabilitation, cancer survivorship, nutritional education, patient navigation, psycho-oncology, senior oncology, and support groups. This kind of therapy is very important for patients because they must often go through a gauntlet of experiences within the cancer center that are emotionally challenging. They must cope with the anxiety of undergoing diagnostic procedures, the side effects of chemotherapy and radiation therapy, the trauma of surgery, and the struggle with post-treatment rehabilitation. For these patients, the cancer center is not a place that they can easily deal with their emotional and cognitive challenges because they are too busy dealing with the physical aspects of their disease and the treatments that they must undergo. So I asked myself, what can I do in order to enhance our cancer support programs so that patients can really focus on healing the mind and the spirit as well as the body? What if there was a way that patients' treatment regimens could include some recovery time in a more private place, relaxed, in the midst of nature? Some place like this. A place where they could go for weekend retreats to get away from it all and enjoy affirming and uplifting care in a spa-like setting in the heart of nature. A place where they could participate in counseling and educational sessions, meet with patients that have similar diagnoses, and deepen the experience provided in disease-specific support groups. Participate in integrative therapies like mindful meditation, massage, forest bathing, yoga, tai chi, art and music therapy. Or enjoy a fireside chat with loved ones. Or, if more adventurous, visit an organic farm, paddle down the Yadkin River, or hike one of 4 state parks, or visit one of 12 wineries, all within 45 minutes. And all of this is within a half an hour of the cancer center. What would such a place look like? What kind of facility would be ideal to extend our cancer care programming for patients as they undergo their cancer treatments? A recent survey showed that 37% of Americans already involve themselves in some form of integrative or complementary health care. There is a section in the National Institutes of Health dedicated to complementary and integrative care, and they have positively identified these modalities as being scientifically valid, in addition to the positive direct health benefits of spending time here in nature. What a wonderful opportunity this could be to extend the emotional, psychological, and spiritual care that our cancer patients and their caregivers receive. So, quite simply, how can we incorporate some of this into the care we offer patients here? So this is my vision, to promote and extend our cancer center's overall therapeutic programming, which includes the integrative, palliative, and counseling services it provides. And this is my mission, to create a retreatment center for our patients. That's it, a retreatment center. For our patients, our cancer survivors. That's it, our can survivors. Here, we can find an ideal place for cancer patients and their caregivers to breathe in this wonderful fresh air in this quiet, natural setting, to collaborate with providers in a relaxed and personal way, to connect and share with other cancer patients, to better cope with their fears and anxieties, to heal the mind and the spirit as well as the body. Our combined campuses here in Winston-Salem and in Charlotte treat over 17,000 patients per year. I have met with a host of providers and cancer survivors who are excited about creating a retreatment center experience for our patients. And we can partner with well over 25 local and regional nonprofits, in addition to national nonprofits that are dedicated to the care of cancer patients. To make this dream a reality, I need your support. Follow our progress as we build the facility and partner with us to design and deliver the kind of programming that I know will be so helpful for our patients. In future videos, we will examine the specific architectural concepts for the center. We'll get to see the construction phase as the center is being built. Also, we will get to see some of the specific programming that will be provided. Along the way, I will share with you more of my personal motivation for this third act and some of my observations as an academic surgeon with over 25 years of experience caring for cancer patients. Stay tuned, because this is the year the Retreat Center will be built. Together, let's create a team of Retreat-ment Center caregivers for our CAN survivors. Please share this vision with me and join our group of Retreat-ment Center caregivers. Contact me at scwilson@wakehealth.edu, and be sure to like this video and subscribe to our YouTube channel. Let's see what we can do together.